Dr. Jolene Brighten is a board-certified naturopathic endocrinologist, certified menopause specialist, and best-selling author of Beyond the Pill and Is This Normal? Known for her no BS approach to women's health, she helps women tackle hormonal imbalances, period problems, and sexual wellness head on. As the founder of Dr. Brighten Essentials, she's created science-backed supplements that cut through the noise of the wellness industry. With deep clinical experience and a bold, empowering voice, Dr. Brighten is redefining how women understand their bodies, from hormones to libido and everything in between. Let's welcome Dr. Jolene Brighten. Thank you so much for being here, and welcome to the Broads Podcast.
Yeah, thanks so much for having me. I saw on Instagram, you were like, my audience is all asking for me to interview you. And I'm like, well, then we should definitely do that.
Yes. So again, thank you. Let's just dive right in. You are a wealth of knowledge. You have so much out there. You could talk about all the things, but first let's start about hormones. What made you realize that women were just being completely misled about hormones?
Oh, I think the big epiphany for me is when I was sitting in medical school and we were being taught infertility course. Okay, this wasn't like general gyne. This was talking about special cases of fertility. And they said, a woman can only get pregnant one day out of the month. And I was like, wait, what? Wait, come again. I've been taking this pill every single day because I was told, like many of us, we could get pregnant any time of the month. I also had like horrifically painful, long, heavy periods. Turns out 29 years later, it was endometriosis. And we could definitely talk more about that problem later. But I just realized that I'm like, wow, we're being handed buckets of lies, boatloads of lies, if you will, about our body, being told things like period pain is normal, heavy periods are normal, hating your body, hating your cycle, hating your hormones, that's all normal. You can get pregnant any time of the month. Like all of these things are absolute lies, and yet we're being handed them over and over. And I can't help but think, if women were given the knowledge about their body and how to take care of it, the reality is that what it takes to feel well in your body doesn't happen in the doctor's office. It happens with your daily lifestyle and nutrition choices. Like the pharmaceutical industry would be crippled by us actually knowing our body and knowing how to take care of it. And so I do believe all of this has absolutely been by design. And so whenever I say this, people are like, you're anti-pharma. I'm like, friend, I'm on thyroid medication every day. I'd be dead without it. I'm very grateful for pharma and for their innovations. And at the same time, in a capitalistic market, it's not just pharma, it's also the beauty industry, right? There's like so many industries that profit off of us not knowing, but also hating our bodies.
Absolutely. And you really have seen it all. Did it take you the 29 years for you getting into endometriosis for you to realize, like, I'm here, I need to make that shift?
Yeah. So I had excruciating periods at age 14, like
Yeah.
missing school, vomiting. I was told it was normal over and over again. I bet there's not a woman listening to this podcast who hasn't been told something is normal when her intuition said it wasn't. They put me on the pill. I did 10 years on it. I came off. I lost my period. I was told, oh, you just must have PCOS. I'm like, there's no way I could have PCOS. Like I counted down my periods like it was doomsday. And I worked on, when I finally got my period back, it was horrific again. And I really worked on my nutrition, my lifestyle, and I had a nutrition degree. So I like very grateful for that. And I was able to get my period pain under control. My periods became very manageable. I actually didn't even know unless I was tracking it when my period would show up because I had so minimal symptoms. And that made doctors, when I presented with secondary infertility, be like, well, there's no way that it could be anything else but you just being old. Except that everything about my labs, they were like, oh, you're normal and you look like someone 10 years younger than you. That I'm like, okay, well, like, how is it that I'm just old? And it was an incidental MRI actually through Prunuvo. Full disclosure, they offered me a deal where they were like, we will give you the scan for free. Please post about it on your social media. And they were also really great because I was like, If I don't like what you're doing, if I feel like it's ick or shady, I'm not gonna post about it. And they're like, fair enough, come have the experience, see what you think. And I came out of that scan and they're like, yeah, so it looks like you might have endometriosis. We're not diagnostic for that. You need to follow up. And I'm like, wait, what? Yeah. And then I followed up with getting a gel MRI, seeing a specialist, having ultrasound, and lo and behold, I had deep infiltrating endometriosis, which is the reality for many women who are put on the pill and not have their symptoms taken seriously. Even while I was on the pill, I had ruptured cysts. Turns out that those were likely endometriomas. Nobody talked to me about endometriosis. They just said stay on the pill, which we know isn't a treatment or cure for endometriosis by any means in terms of preventing its progression. For some people, it helps with symptom management. The only reason it helped me in any way is because I just stopped having periods. And I just stopped the withdrawal bleed of the pill. And I was like, well, I'll just go years without one. And then I won't have to have pain. So, that's like my long-winded story. But, it's, as much as it sucked to go through all of that, I'm like, I'm really glad I did because I will advocate for every woman and share this story because I will keep the rage I have towards the medical system who doesn't believe in our symptoms, who doesn't believe in taking us seriously, and who says things to us like, oh, you're just old. That's the problem. I'm like, you never even checked for endometriosis and you just told me I was old.
Also, what is old at this point? I mean,
Ah,
you're still
yeah.
44. Like, that's not even old by any means either.
Well, and when I started this, like I had my second child at 40, like conceived naturally. Everything was just really boring the way you want it to be.
Yeah.
And so then when I started having miscarriages at 41 over and over and over, I was like, what is going on? And they're like, oh, you're old. And I'm like, but I don't understand. People in my family have had, babies well into their mid 40s. Like, so genetically speaking, I have that going for me. I also like have no signs of perimenopause. And when you look at like all my biomarkers, they're really healthy. And so, I did end up going through IVF and we made embryos and they were really healthy embryos and we got lots of eggs. And seriously, it was just a couple months ago that, so anyone who goes through IVF, we count all of our follicles, which are the pre-potential eggs. You only get one unless you do IVF. Then you get to save all of them from expiring. And I had over 18 eggs. And it's like, that were like, the potential, the follicles, which is unheard of at like 43. So I'm like, it was never that. It was the endometriosis.
Yeah. And you didn't even know.
No.
Wow. Do you think that the pill masks a lot of our gut or intuition or feeling as women?
Oh gosh, that's such a great question. And I would say yes. If you listen to women, yes. So Dr. Sarah Hill, for everybody listening, she is a psychologist and a researcher. And so she really takes that psychological behavioral perspective into her work. It's very interesting because I wrote Beyond the Pill. That came out in January. And then I think her book came out in September. So they came out like the same year. And I had the privilege of reviewing her book. And it was so interesting to me because, and her and I connected and we were like, okay, so everyone's telling us that we're like anti-pill and we're crazy and all this stuff. And yet we both read the research and came to the same conclusions about what's going on here. So there's, the one way that the pill is used, which is incredibly problematic, and it absolutely has to change in women's medicine. And there is absolutely no excuse for this. It is used often for symptom management without ever discussing what is causing those symptoms. And two primary conditions, which are leading causes of infertility, is PCOS, polycystic ovarian syndrome, and endometriosis. So you have heavy, painful periods. They put you on the pill. And a lot of doctors are not educated enough about endometriosis. So they still say things like, oh, well, if we want to know if it's endo, you have to have surgery. Wrong. If you want to know if it's endo, you refer to an endometriosis specialist, somebody who's actually skilled in this, because your average OB-GYN is absolutely not. And they get mad when I say it, but it doesn't change the truth. You've got to go to a specialist. They can see it on imaging. They can see it when they do an ultrasound, and they can see it with doing something called a gel MRI where they can do endo mapping. These are two things that I had done. I did go through excision surgery. It would never go through excision surgery without somebody who would actually map it first and see what's in there, because otherwise they're going in blind. They can't do a great informed consent because you don't know what's going to get cut out. And you don't know who needs to be there. So if you're like, what do you mean who needs to be there? It's not just a gynecological surgeon. If you have it in your bowels, you have to have a colorectal specialist there. If you have it, some people have had it in their eyes, they've had it in their shoulders, they've had it, diaphragm is really common. Having it, around the heart could be a possibility. So wherever it is, you need that specialist that's also there. And knowing that we need to have that person at least on call or in the room is so important. Then there's the other aspect of polycystic ovarian syndrome. So you have oily skin, acne, hair loss, irregular periods, and they put you on the pill and they tell you this really pretty lie, which is that the pill regulates your hormones and regulates your cycle. Let's all talk about how the pill works. The pill is enough hormones that come in that it stops your brain from talking to your ovaries and your ovaries stop functioning. If your ovaries are the primary glands that are making sex hormones and you take a medication that stops them from working, how did that regulate them? It didn't. It stopped them from working. Now, this can be super effective for PCOS. So we're going to stop the ovaries and we're going to influence the liver to increase sex hormone binding globulin. So we make testosterone from our ovaries, and that's what's driving these PCOS symptoms, but we also make it from the adrenal glands. And so the pill can absolutely help with symptoms. So if you're listening to this and you're like, no, but I'm on the pill because I don't want to have acne. Yeah, okay, great. Like, that's great. It works super, super well for that. And if you're not having side effects, let's support you in that. But my issue is when nobody talks to you about this being PCOS. And this is where at this time, we not have research that says the pill causes infertility, but we have lots of women who are like, the pill caused my infertility. Why are we hearing that? What I believe to be true is that we put women on the pill for these conditions. They don't know they have these conditions. Nobody worked them up. And then when they come off, they find they're unable to have a baby. Why? Because the longer you go without getting a diagnosis and getting endometriosis addressed, the deeper it often goes. So now it's infiltrating other organs. So for me, for example, it not only was in my ovaries, but my bowels were glued to my uterus. That's not great. And let me tell you, recovering even just from having my bowels be shaved off, it was not fun. So with that, we've got that piece. And if people are like, what does that do to your fertility? Well, it wrecks your egg quality because you've got systemic inflammation destroying the quality of your eggs. With PCOS, at the crux of it, as far as we understand, we need more research, is insulin dysregulation. The pill will not address the insulin dysregulation and the inflammation that goes along with it. So as long as you're on the pill and you're getting the withdrawal bleed and you're like, oh, I have a period, things are fixed. It's important for you to understand, if you haven't been doing the nutrition lifestyle aspect, we've allowed the disease progression. And we know that insulin resistance, inflammation, so it doesn't have to be insulin resistance, just blood sugar dysregulation, or having increased adiposity, so fat cells in the body, specifically visceral, which is around your organs, which is what we tend to see with PCOS. All of that is going to be making it harder to get pregnant as well. And so I think what often happens with the pill, we're given it for those reasons, but also we know that the pill can change behavior. It can change how our brain functions. It can change our stress response. And so there is this big question mark of what does it do to women's intuition when you disconnect our brain from the hormones that it depends on? Because while the estrogen's pretty closely matched, the progestin in the pill is nothing like your progesterone in terms of how it actually operates in the brain.
Wow, that was a beautiful explanation of that, and we can go so many different ways from it because, like, when I originally asked you that question, it was like, is it masking how we feel? But really, it's masking so many other things. And can women actually still understand PCOS or if they have endometriosis while they're still on the pill ever?
Yes.
Yeah.
So this is the thing that is important to understand is the pill is a tool and we
Yeah.
can utilize that tool, but we have to be honest about the tool. The tool is not fixing anything. It is not curing anything, but it may help buy you your self-esteem, regulating your testosterone rate. I think often people are like, oh, it's just acne. Acne can be detrimental to someone's mental health. Hair loss can be detrimental to someone's mental health. With PCOS, we never want to see the endometrium build. So the lining of the uterus, what happens in PCOS, we have irregular ovulation or lack of ovulation, which means no progesterone. So you never make progesterone without ovulation occurring first. And so without progesterone, we don't challenge estrogen. We can get endometrial hyperplasia. And so there may be a time and the place to put you on the pill because it can thin the lining of the uterus, but also to give you a withdrawal bleed so that we don't end up with endometrial cancer. Because if you go years of not having a period and that just tissue being stimulated by estrogen, you could have a cancer risk. So there's a time and a place for it. Most women that I speak with endometriosis, they don't feel better with the pill. And they're dealing with a lot of side effects, thinking this is the best thing that they have. I had horrendous side effects that I was also told was just a me issue. So I suffered from significant depression. I had yeast vaginitis. Like there was just no libido, which is very common and very weird when you're in your 20s and you're just like, am I asexual because I just could care less right now. So, it's about the trade-off, right? If you're someone who's like, I'm not really having any side effects and this is working for me right now. So something I'll say, I don't know if you have Canadian listeners, but this is just listening to women in Canada. It's awful. 6 months to see a gynecologist. They usually like brush you off, tell you your period pain's normal, another 6 months to get to the next one. They finally diagnose you and say, well, they don't diagnose you. But they say, I suspect endometriosis. So now we went a year. Now it's 2 years for you to get to the specialist to actually do an excision surgery or get a laparoscopy to understand, is this actually endometriosis? So we're talking like 3 years. You might need to use the pill in that time, similar to what I did, and just be like, no period, nothing at all. Like we're just going to stay static with our hormones. But again, it's all about what is true for the individual and the risk versus the benefit. If someone's suffering from side effects significantly, then we have to look at like different pill formulation. Maybe we go the IUD route. Like maybe there's a different way that we go. But really, the ideal with both PCOS and endometriosis is that we get you on more of an anti-inflammatory diet. We start working on the lifestyle. We have to get you sleeping. And without melatonin, we don't have that antioxidant protection of it. We have to get you exercising. It's one of the things that every time I was in an endo flare, I remember just being in bed and I'm like, okay, I know if I work out, I know 10 to 15 minutes in, this pain is going to go away. But how in the hell do I peel myself out of this bed and actually go work out? It's difficult to motivate yourself. And yet I would get up and make it happen because I knew like, okay, if I can just like hit that 15-minute mark of like lifting heavy weights, I'm going to get that endorphin surge. The pain's going to go away. It's going to be much less through the rest of the day.
Yeah. Excuse me. And I love that you're taking so many things into consideration. Like, obviously, I'm a strength coach. I love that you lift. And I also love that you said do 10 to 15 minutes, because that is, in any capacity, a way to get your body moving. And that usually wants you to do more. But I appreciate the fact that you don't just talk about hormones. Like you've already mentioned sex and menopause and real conversations in the mix. So is that always how you've been, or did you kind of lean into being more of this no BS kind of doctor?
So I grew up in a family where it was like, we don't talk about our bodies. We don't talk about anything. It's just super shameful. And that always just struck me as kind of weird. I also was just like a really curious kid, and being neurodivergent, I'm not so great with social cues. So just like say things and ask things. Like I didn't understand why people would get offended sometimes. I still don't, where I'm like, okay, you have to explain it to me because I didn't need to do something wrong. But it's always just been kind of like in my nature. It's also something to, we started talking before we recorded. I'm 7 weeks pregnant. I've been sharing my journey, and I've had people say to me like, well, what if something goes wrong? And I'm like, what I realized after going through several miscarriages is that the keep it to yourself and don't tell anybody until 12 weeks was never for me. It was always for the comfort of somebody else. And it's really when we start sharing our stories, we start normalizing these conversations about normal things, that we shed a lot of shame. I think very early in our society, from like the moment we can understand our body, we're taught to feel shame about our body. And that gets in the way of not only our health, but living a full life. And that is why I just take the perspective of like, we just have to normalize conversations about normal things. Like, why should I feel ashamed? Why should we feel ashamed we have a bowel movement? Like, every creature on the planet is going to put food in their body and going to excrete it out. Like, these are just things that happen. But also this just idea that like periods should be shameful, infertility should be shameful, having, a medical condition of some kind should be shameful. And it's like, this is happening to millions upon millions of people every single day. And the worst thing we can do is suffer silently and feel like we're the only one.
It's so interesting you say that because I feel like you're the only one that I've ever seen post about a pregnancy before 12 weeks. I think it's so powerful. And I think you're helping so many women because even like close friends don't even tell close friends until they're 12 weeks. But, something obviously can happen in that journey where they need their friends the most,
Yeah.
and you're kind of leaning on the people that follow you to do that, which is incredible.
It's also something too that, a lot of people, because prior to this successful pregnancy, I had 3 failed embryo transfers and 4 miscarriages. And people are like, what can happen? Like, why would you share this? Like, and make yourself so vulnerable, and it's so scary. And I'm like, you know what? Because like, there's so few moments of joy in the journey of infertility. Why wouldn't I seize the joy I have today rather than letting the potential fear of tomorrow take that from me? And I would rather every time have the joy, have the excitement, and then also have the letdown when it happens. And it hurts and it sucks, but I feel like leaning into the joy has made it so that when there is the pain, there's like a buffer there, right? Because life has peaks and troughs all the time. And if we're always worrying about where's the next trough, then we're not living in the moment of that. But I really wanted to share my experience because, and I will say this, celebrities don't owe us anything about their health or their body, but a lot of them pop up and are like, I'm 45 and I had a baby. I'm 48 and I had a baby. And women don't know that like they probably used a donor egg, or they went through IVF, they froze their eggs a long time ago. And I didn't want to be that person that showed up online like pregnant at, even, 40 I conceived naturally. But when I decided to go the route of IVF, I'm like, I'm going to be really honest about this. I did lose a lot of followers. People were like, I'm so disappointed in you that you would like even do this. And it's like, if I knew I had endometriosis, I would have gotten an excision first and I would have like tried naturally. Sure, that would have been the route I went. It's just not the way things went. And I'm actually really glad I went through the experience of IVF because that's also, you've got knowledge, right, that you can learn, but then there's knowledge through experience. And I think having that experience has really helped me, not just with compassion, but just understanding what women actually go through when they're going through infertility and what they're dealing with in these clinics sometimes. So, I'm very transparent about things. And I think that the more honest we are, the more it helps one another. I don't think everybody needs to necessarily do that, right? You have to do what's right for you. But I have had a lot of women reach out to me and be like, it's actually like, as much as it sucks that you're struggling, it's so good to see that you struggle too, and to normalize, all of that. And I think that it's really silly when people unfollow people because they're like, I thought you'd be perfect your whole life. I've also had people that when I said like, oh, I had endometriosis, this is wild to me. The way they've been like, well, if you were such a hormone expert, then how did you end up with endometriosis? Like, if you were so good at what you do, then why do you have this? And I'm like, oh, see, when I was an embryo, I didn't know anything about hormones. And as my cells divided, they ended up in the wrong place. And I'm like, this is wild that you would think that like, and it's like, the fact that I knew so much about hormones is why I didn't have painful periods. I managed my endometriosis naturally. Like, they didn't even know I had it until they did imaging. And honestly, it was IVF and the hormones I went through that flared the whole thing and made like endo flares like part of my reality. By the way, everybody listening, because the endo flares were so bad, I actually put together this guide at drbrighten.com/ Endo Flare. And it's about like the things I use to get out of flare short term and long term. And I even have a TENS unit protocol in there as well. So again, I'm like, it's actually a good thing that I've gone through all of this because I'm like, I need to make a resource for this because as I was like, oh, here's things I did for patients. And then I'm like, okay, but I need more and researching it. And then I was like, I should just make a guide and like give that to people so that they don't have to struggle as well. So it's, I will say going through all of this has made it to where I've built way more resources for people where I'm like, okay, like there's just not enough out there. I'm going to just do this myself.
And the people that are unfollowing you don't need those resources, and that's fine. And they're not your people anyway. You put yourself on this platform, right? You're sharing a lot of vulnerability and just who you are, and people need to see that. And so if they don't appreciate it or if they don't like it, like I'm always like, bye, you don't need to be here.
No, I'm right there with you. And I think
Yeah.
I think everybody should really recognize that some people are kind of always waiting for you to fail. And they're not following you because they like watching you win. They're following you for the moment that you fail so they can call it out and then be like, I'm unfollowing you now. And it's like, okay, you're unwell and you're not mine to fix. Like that's like, you've got to go take that somewhere else. And I do hope you get the help that you need. But people who are living like in their integrity and a really rich and full life are not out there watching for people to fail.
Wow, that's beautiful. Say that again. You said people are waiting to watch you fail, right?
Yeah. Yeah.
Yeah, they really are. All right, Jolene, I think we should talk about sex. What do you think?
Let's do it.
I love talking about sex, but actually that was one of the things that I started bringing up a little bit more, just sexual wellness as a part of my own brand. And as soon as I said I had a dildo, oh my gosh, the amount of unfollowers that I had. So I know
it's very on brand for the US, right? It's very
I'm like
US.
Okay. All right, cool. So I know that you talk about sex on your page. I know that is you are pro sex. You also have helped so many women get their sex drive back. So what is the connection we can take from hormones, stress, lifestyle that women can feel to, get their sex drive back?
Yeah. So I want people to understand that your sexual desire, your interest in sex, it should be considered a vital sign. So if people aren't familiar with my book, Is This Normal? People were shocked because the first half of the book is all about sex. And then the second half is all about hormones. But that book is just answering all of the questions that I've gotten, over, my 12 plus years of practicing medicine, that people say to me behind closed doors only. So the thing about your sexual desire is it is complex. There is this really cool model called the dual control model that Bancroft and Jansen developed, and they developed it for men. Like most research, let's think about a penis first. So, and then sexual health is like, it's like a freaking call 911 event if like men have erectile dysfunction, right? Which I think frustrates a lot of women because they're like, we have all these issues and medicine's like, meh, whatever. Oh my God, stop everything. Erectile dysfunction's upon us. So erectile dysfunction is actually very concerning because usually it's pointing to cardiovascular or metabolic issues. So I'm not trying to like dismiss that, but it's just the fact that researchers are always like, let's understand men. Oh, but by the way, maybe we should understand women. And it turns out this dual control model applies to every single body of humans. And that is the concept that we've got gas pedals and brakes. And so the gas pedals are everything that Hallmark tells us that we should be wanting on Valentine's Day, like chocolate, get the roses, lingerie, teddy bears. I don't know how teddy bears are a turn on, but okay, like if that's what you're into, we're not going to shame that. And so that's where a lot of people focus. And yet what we disconnect from is how important the brake system is. So I want everybody to just kind of picture a train track. That's your nervous system. And the train is the sexy signal. Let's just chug along and get to your brain and say, hey, sex, yes or no. And usually the brain's like, yes. And the nervous system's like, yes. But consciously you might be like, no. Okay. So I want people to know that no matter how your body responds, what your conscious brain says, that's the final word. If it's yes or no. Now, what happens is that we can have breaks being laid down on the track throughout our day. So, I tell the story of my patient, Jill, who she, starts her day like a mad mess because nanny doesn't show up. And now suddenly she's mom to two kids at home and she has to take a meeting virtually, which ends up a complete mess because she's got a baby strapped on her. So she feels like a failure there. And then her boss sends her an email and is like, let me just reiterate, yes, you are a failure, and just lays into her for how that meeting went. It lays a break on the track. That's a stressor. She comes downstairs, finds that like her toddler has exploded the kitchen in ways she didn't know was possible. And so she's got to clean all that up. She's got food all over herself. And as she's going into the laundry room, she slips on a pair of her husband's underwear. And she's like, again, he can't just like make it into the hamper. So now we've got another stressor that's laid things down. As she's getting changed out of those clothes, she catches a glimpse of her body in the mirror and she sees like, oh my God, where'd that cellulite come from? Like, when did my body start changing like this? Now we've got body image issues coming up. That's laid down another break on the tracks there. And, she's like, okay, home stretch. My husband's going to bring home takeout. As soon as he gets home, I'm going to get some support. Like, things are going to get easier. And he comes home and he rushes in. He's like, sorry, I didn't pick up takeout because the game's on and I don't want to miss it. Like, can you just whip something up quick? Okay. All right. Lays down a break. And she's like, wait a minute. I just need to talk to somebody. Like, I've had this really hard day. Like, can I just vent? And he's like, not now when the game's over. Okay. Relationship issues, laying down another break on that train track. And so after the game's over, he comes over. He's like, you're looking so good. Like, she's bent over the dishwasher. He nuzzles up on her. He's like, I know if I just like bite her ear, she loves that. Drives her wild, right? That's a gas pedal. Except that he tries to hit the accelerator on the train, but the train can't go because all of these brakes have been laid down. All of these stressors throughout the day, some of which is Jill stuff, right? Feeling like, I'm not uncomfortable in my body. That's not a him issue, but there's other things that are a him issue. And so this is an example of how you can have all these stressors impacting your nervous system and it keeps you from receiving the signal. And then often what men say is like, oh, well, she's punishing me. She's just withholding sex from me because I didn't pick up the takeout. So she's like, you did a bad thing. You don't get sex. That's not what's happening. Her nervous system literally cannot receive the signal. She's not consciously being like, oh, I'm mad at him. I'm not going to have sex with him. Her nervous system's like, I'm frazzled. It's like, just like, all of this input coming in that like, I can't even sort through the different signals that are happening. I need better regulation of my nervous system. And so this is where understanding yourself, working through definitely your own stressors, right? We can do the deep breathing. We can do the exercise. We can work on positive affirmations about our body, but also recognizing what's happening in the relationship is so helpful because on the hormonal level of what's happening there is cortisol is coming up and it's overriding the sex hormones because as humans, we have two primary objectives on this planet. Number one is survive. Number two is procreate. Sex hormones are about procreating. And if number one is not working and that's a threat, then number two is negotiable. And so that's really important for women to understand. Not only will that affect your sex drive, but it will also affect your ovulation patterns. It will affect your periods. It will affect your PMS. And so when we recognize that the first thing we need to do is feel safe in our environment and our body, we can start to drop some of the shame about not feeling in the mood, not being interested in sex. The other thing I'll say is that what we know from the research is that not everybody is walking around thinking about sex all the time. That spontaneous desire we always see in the media where it's like people are just into sex or it gets mischaracterized as a predominant male pattern that men just always want sex. Also not true. There's something called, so we've got spontaneous and we've got more of a reactive desire. And that's where we've got basically inputs have to start coming in for our body to be like, okay, now I'm actually in the mood for this. And so we may not actually be like just thinking about sex or interested in sex, we may be more inclined to be like, once things get going, then my whole body system is interested in it. And that's also normal, but it's often seen that responsive desire that I'm talking about, that is seen as somebody who has a low libido or is not interested in sex, which is not true. They just have a different way of being interested in it than what we predominantly are told is normal. Both are actually normal. We find in the population that it's pretty split. And so what does that tell us? That both are normal.
Yeah, absolutely. And I can so relate to that because I've always had a higher sex drive than my husband. But everywhere I've ever seen, it's like, well, men should have this. And,
Yeah.
he should go get checked out because it's not. But it's like, that's just how it's been in our relationship. Now, sex as you age, especially as women, this is a women's podcast, Dr. Jolene. So tell us how your sex drive changes, especially like going into perimenopause and menopause.
Yes. Okay. So, one thing that's very, very interesting from the research is that one of the biggest things will shut down our desire for sex, or even in the moment, like everything's already gotten going and it's feeling good. And then you're like, yeah, no, I'm not interested anymore, is the threat of an unintended pregnancy. So when women don't want to get pregnant and they're like, oh God, could I get pregnant? I don't know where I'm at in my cycle. Are we using the right protection? What if it fails? That takes you out of the mood really quick. So what we know about menopause is when there's no longer that threat, some women are like, I'm having the best sex of my life because I'm no longer concerned about that. So it's a myth that your sexual desire will just go away because you age. There's a lot of factors that influence it actually going up. However, as our hormones are changing, that absolutely is going to impact our sexual desire. And here's the thing. Testosterone hormone replacement therapy should be the norm for women and should be considered in any woman who is exhibiting symptoms of low testosterone or on her labs has an objective finding that she has low testosterone. The FDA, being as archaic as it is and giving so little F's about women, is like, only if you have hypoactive sexual desire. And what is that? It's that you're not interested in sex and it's so low that it makes you distressed, that you're like, I feel stressed out by the fact that I'm not interested in sex. So, and what is that? That's a mood symptom. Testosterone really governs our mood. So when you don't feel like you can set boundaries, you're people pleasing, you're getting walked all over, you wake up in the morning, you don't feel like you can kick ass and take on the day, usually that's a sign of low testosterone, along with the inability to gain muscle mass or retain muscle mass. We also see a lot of ADHD traits will be exacerbated when you have low testosterone as well. But while testosterone gets all of the play when we talk about sexual desire, estrogen is really one of the real winners in this arena. And so, what I want women to understand, I go through this in Is This Normal? And I take you through mapping your entire cycle and how your sexual desire changes, because women will think something's wrong with them, or their partners are like, why were you so into me and now you hate me? Like, what's happening? And I'm like, they ovulated. Okay.
Yeah.
And here's what happens is that your estrogen is so interesting because the research is like, there is a sexual phase of the menstrual cycle. As soon as I read the abstract on that, I was like, they're talking about ovulation. They're talking about the ovulation window. I know this. And they were, lo and behold. I really do love framing it in that way because I think talking about the ovulatory cycle is great when you want to try to get pregnant. When you're like, I don't care about getting pregnant, knowing that like, well, you have this sexual phase of your cycle and really reframing it in that way, I think is very empowering. So in about the 3 days leading up to ovulation, sometimes for the day of ovulation, and then, roughly within 24 hours past ovulation, that's going to be your peak sexual desire of your cycle. What does that correspond with? Estrogen riding really high. When estrogen goes high on our brain, we tend to have more sexual fantasies. We tend to be a lot more interested in sex. Mama Nature made no mistake in how she played us with this one. Okay. So, and what is this for? It's so that we go out, we find a mate, we capture some sperm because sperm can live like 5 days, and then it's around when we ovulate. So this is all about like the biology of our species trying to stay here on this planet indefinitely. Now, once you pass ovulation, what's left behind in the ovary is the corpus luteum, and that structure is going to pump out progesterone. So that progesterone is going to start going up, up, up. And once it starts climbing, your body says you had the chance to get that sperm. Well, you could, okay? By the way, I talk about sperm, but you might be in a same-sex couple, but it's still like the procreation process of what evolution is trying to do here. So once you get into that like luteal phase with progesterone, you're going to be less interested in sex. I would say you're going to be more interested in getting a pair of sweatpants than getting into their pants, and that is actually normal.
Yeah.
And if your progesterone's not optimized, because people are like, well, screw progesterone then. No. Because if your progesterone's not optimized, now your nervous system is more dysregulated, and your partner's going to have to put in a lot more work to helping regulate your nervous system. Whenever I see men out there that are like, our job is to be the protector of you, and like they talk about like bears and tigers and stuff, like, we're going to defend you. I'm like, bro, where do you live? Okay, I live in a city. Well, there might be a raccoon. I don't know. Like, they are fierce, but like, no, actually, your job of being a male protector is more protect her nervous system, guard her nervous system. And I hate to break it to you, but cohabitating with men is one of the most dysregulating things for our nervous systems, because we operate differently, and we tend to take on more of the share of the domestic burden of like just running a household. So now, to know that that's how like things are operating when you're cycling, what happens when we get into perimenopause first is we ovulate, and then maybe we don't make that progesterone so well. And then as perimenopause progresses, now we ovulate less regularly. Now, estrogen is a good thing until it's going unchallenged, because now when we have unchallenged estrogen in the brain, and there's lots of it, we actually are far more critical of our partners, and we're far more irritable. And that's what's happening initially in perimenopause. Estrogen is so unpredictable. It's first going to be like high. Then it's going to be rocking and rolling up and down. And then it's going to plummet. And as it plummets, now we not only have the effect on the brain, but our tissue no longer gets the same stimulation. So we don't self-lubricate as well because we don't have estrogen. So estrogen stimulates the cells of the vagina to produce glycogen, which is a sugar that feeds the lactobacillus acidophilus that everybody knows for preventing yeast infections, but they create acid. That acid maintains the pH. Then we don't get yeast infections in BV, right? If you get yeast infections in BV every time you have sex because of having low estrogen, well, why would you want to have sex? Like, your body's like, this sucks every time. I got to go through like 7 days of monostat, or like I'm popping a diflucan. Like, nobody wants that, right? So it can be layers of like what's happening with the hormones, what's happening with your body. Then there's also just all of the changes that are happening in perimenopause, right? So like our muscles are achy and our joints hurt more sometimes. We're more irritable. We have lower mood. We know that roughly, close to 40% of women are going to be at risk of developing anxiety or depression. And when they're in perimenopause, that's going to affect your sexual desire. With, I think the estimate I saw most recently is a third of divorces are being initiated by women in perimenopause. Well, why is that? Well, when we have estrogen and progesterone optimized, our executive functions are on point. Okay. So our ability to plan, strategize, organize, meal prep, right? Like all of these things that we kind of take for granted and put up with bullshit. For all intents and purposes, we put up with a lot of bullshit from people in the world. When your hormones are no longer your best ally, and they're like going into retirement, your executive function starts to struggle, and you're not going to be able to carry the burdens of other people as much. And that can create emotional strain, relationship strain, and not just with your partner, with other people. And now what are we talking about? More stressors coming in that are being laid down on the track that can affect your sexual desire. So when you're in perimenopause, if you have pain with sex, that's not normal. Get that checked out. If you're having any vaginal dryness, you're getting UTIs, yeast infections, BV every time you have sex, you are a good candidate to talk to your doctor about vaginal estrogen, which does not go systemic. And literally anybody who is in menopause should be on vaginal estrogen, because not only can it save you from like a life-threatening kidney infection, but it also can save your pelvic floor, which means better orgasms, but also means not having urinary incontinence, which is one of the primary drivers of why women end up in nursing homes. So we would like to prevent that as well. And then, it's unpacking all the other aspects about like, what is my stuff? What is my relationship stuff? And having to address that head on. And along with, this is the truth about once you're in perimenopause, you get no leadway like you used to, right? In your 20s, you used to be able to not sleep, decide to sit down and eat a whole cheesecake with your friends, not a problem. Go out, binge drink on the weekend, recover by Monday morning. It doesn't happen like that anymore in your 40s. And so you also have to see it as an opportunity to take the best care of yourself.
How do women even know that they're in perimenopause?
So here's the thing is that there's this myth that it's all hot flashes and night sweats.
Yep.
So perimenopause is actually going to start with sleep issues, worsening TMS, more anxiety, because who's going first? Progesterone. She's the first to exit the stage. So you're going to notice this as early as age 35, but maybe more like 45. So perimenopause, from the research, we say it can be 7 to 10 years before menopause. Menopause is on average 51. Some women don't go into menopause until much later. Other women are going to be in perimenopause for 15 years sometimes. That's a possibility too. So I want people to understand whenever we say an average, it's a bell-shaped curve. And so whatever we say the average is, know that you can be on either side of it and you're still normal, and that you don't have to be 7 to 10 years. You could be less, you could be more than that. So the first thing as progesterone drops, we have worsening breast tenderness, we have more anxiety, more insomnia, waking up in the middle of the night, unable to stay asleep. That's because and this is why don't let anyone give you progestin in perimenopause. It's absolute bullshit that the pill is given. I get if it's economical and it's like, that's all I can afford and I need help. Okay, we understand that. If you have severe PMDD, which is it's way worse than PMS, and it can come with suicidal ideation, and the only thing that works well for you is the pill, we may want to consider using it. If you have disordered uterine bleeding, and we've got to get that under control so we don't end up with an iron transfusion, we may need the pill to shut it down. So I did a whole episode on perimenopause, and I have episodes on the Dr. Brighten show about who should consider HRT, perimenopause weight loss, like all kinds of topics that talk about HRT as well. And I want you to understand that there are some times that we use the pill, but it's very, very important that we don't use this just for perimenopause symptom management. Now, I say this is because progesterone, when you take it orally specifically, or you make it from your ovaries, there's a metabolite made called allopregnanolone, and that goes to the brain and it interacts with the GABA receptor. That makes you feel chilled out, calm, and you go to sleep and you stay asleep through the night. Caveat is, unless you're neurodivergent, that we're starting to understand that neurodivergent women maybe have a different way that they're processing allopregnanolone and interacting it with their GABA receptor. And you might be someone that's like, I'll just say, like, as an aside, you might need more like 25 grams or 25 milligrams, I mean, every night that don't take 25 grams. Okay. Just very clear, 25 milligrams that you take every night, like constantly. Whereas another woman, we might use 100 to 200 milligrams, and she's taking that like, half of her cycle because her cycle hasn't become irregular yet. So that's the first thing that we're going to see with perimenopause. And when we start seeing those symptoms, I always like to start with the nutrition, lifestyle. Can we get your ovaries functioning at their best as long as we can? And once we get to that point where it's like, okay, sorry, friend, they're not interested anymore in doing this. You're running out of eggs. That's just our reality. Then we start talking about progesterone hormone replacement therapy.
You mentioned in your 30s. I'm 35. I'm like, oh my, like, how do you actually know the difference between feeling these perimenopausal symptoms or just like, honestly, just normal aging?
Yeah. So, well, I mean, perimenopause is normal aging, right?
Well, yes, you are totally correct.
We're running out of eggs.
Yes.
I'm really waiting for the rapamycin trials to come out, which is a drug that they're hopeful can actually extend the life of our ovaries. Full disclosure, once I'm like through pregnancy, breastfeeding, I will probably start it if the trial hasn't come out yet, because I'm someone who's like, it's showing enough data and I'm short on time. Like I only have so much time to like save these ovaries. And I have a lot of friends in medicine who aren't sharing publicly that they're on it, but they are on it because they're like, if I can extend my ovaries producing hormones, then I'm going to have better outcomes long term in life. So, but to your point, so if you're someone who starts having perimenopausal symptoms in your 30s, so usually mid to late 30s, that's where we're like the diet, nutrition, lifestyle, all those pieces that can really turn things around and we can do well. And typically, if your symptoms don't start until like 45, that's where it's going to be like, Yeah, we're going to probably be talking progesterone therapy a lot sooner with that. So it really depends on a lot of factors, and this is where it's like, oh, it's so frustrating because it's like environmental toxin exposure, not just now, but what were your mom and your grandmother exposed to in utero? Like you were an egg in your mom's body, which was inside your grandma's body. So if your grandma was smoking, I hate to break it to you, like reactive oxygen species generated by smoking, some of the worst things for like our ovaries. And so what could you have done about that? Absolutely nothing. Like absolutely nothing. And odds are she, depending on the age of your grandma, it was some doctor telling her it's perfectly safe to smoke in pregnancy, right? So like that's not on you. Like, don't you can't take that on. But that could influence you going into perimenopause sooner. The age in which your mom went into perimenopause is pretty good predictor. However, I will definitely say that, I'm 44. The only time I went on Lupron for 2 months, worst hell of my life, because it's chemical menopause and there is no perimenopause. So it's chemical castration. It just shuts down your ovaries. And there's no like, let's transition. It's just like, boom, hot flashes, mood tanks, like all of this stuff, which I will say, like going through that, I was like, I figured out I was taking boatloads of supplements, but I did figure out things of like, okay, saffron does work really well. And Bacopa actually gives me my brain back, and like figured out a lot of things that I was like, I'm actually glad I went through that, because I feel like I was helping women, but then I had to get really, really savvy of like, what about when it's extreme? Because most of my patients don't get to where like it's feeling so extreme because they've got the transition period, and it's like we can take you in that. The extreme is like you have a hysterectomy and suddenly you're like in menopause, and it's like your body didn't have that transition time. So, to answer your question, perimenopause is natural, normal part of aging. When it comes to being in your 30s, yeah, it could very much be perimenopause starting, but it doesn't mean that you are going to have those symptoms as a permanent basis. Like there's still time sometimes to support the ovaries and get them functioning. And sometimes it's like we've just had major stressor in our life. It's not perimenopause, it's like a major stressor has taken place. And what I was saying before is that my mom started perimenopause symptoms like more like 38. And at 44, I still haven't had hot flashes, insomnia, like any of that kind of stuff. And I attribute that to the fact that like praise the one thing my 20-something-year-old self got right, which was to study nutrition. I swear, I did so many dumb things in my 20s that I look back at that and like I studied nutrition and I really was serious about eating like 6 to 9 servings of vegetables every day, like through my 20s. I'll say it got harder with kids. So people are like, wow, that's like amazing. But like it definitely got harder with kids. But knowing all of that. And then I also was never a big drinker. So in college, I was always the designated driver. And I think that's the other piece of like, okay, so there's just a lot of things I got right in my 20s. Trust me, everyone, I did a lot of dumb things too. I will say that like in grad school, I was like, sure, let's drink a pot of coffee and like stay up till 2 a.m. studying. And like I would do stuff like that. That was dumb. I wish I didn't do that. But it is just to say that like if you are someone right now in your 20s and 30s, everything you do right now can make a tremendous impact on your future self. And so never wait until you have symptoms to be thinking about how do you prevent symptoms. And we don't have to, again, we're not looking for the trough, right? We're not looking forward to like, when am I going to fall in a hole? No, 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 no. We're looking at just like, how do I live my best life now? How am I best to my body now? And I will say, like, seeing the reports of like, Gen Z is not drinking alcohol. They're not going to clubs. They're doing all this stuff. I'm like, oh my God, somebody follow them, study them, because I swear their 50-year-old self is going to be so different than what the boomers were like, right? Than what we see then. We're like cocktails, we're like life is like what you did every night kind of thing, and smoking and all of that. I just am like, this is like a very interesting, a whole entire generation is opting into like healthy lifestyle choices. Let's follow them and figure out what happens.
So what are some of those main healthy lifestyle choices? You've mentioned nutrition a lot. What does that actually
Yeah.
mean?
Yeah, I'm so glad that you asked that because, yeah, I have mentioned it a lot and not actually defined that. So We want to be as much as possible focusing on a whole foods diet. I like to use the plate, an analogy actually in Is This Normal drew a plate so that people could see that half your plate needs to be produce. It needs to be fruits and vegetables. And no, don't listen to people who are like, you shouldn't eat fruit. It's so high in sugar. Like, fruit is so high in antioxidants, and trust me that your ancestors would have never passed on a piece of fruit, like just because like they're like, I don't know, that might have like too much sugar. When we worry about sugar, we're worrying about added sugar. That's what we want to avoid. So, and you're going to do a good job of that if you're mostly choosing plants. And then the other half of our plate, we're going to cut it in half again. And we're going to have a quarter as protein. And then we're going to have maybe grains, or we're going to use produce again, something like sweet potatoes, or even I love having, especially for my endo gals, if you get endo belly, which is like severe bloating, resistant starch from potatoes, that has helped me so much. You put that in the fridge, you cook a potato, put it in the fridge, or you can do this with white rice as well. And then the next day you eat it. And that resistant starch can help your microbiome so much. So we want to set up our plate in eating this way. We're looking for nutrient density, and we need enough protein, fat, and fiber every single day. If you're eating lots of plants and a variety, and you are a meat eater, you're going to check the box on the majority of your nutrients. If you're not a meat eater, like you're vegan, you're going to be much more diligent about making sure that you're getting B12, getting your iron, these things, zinc. We know that these things are more bioavailable in animals. And there's always a vegan who's just like, I hate when people bring up these nutrients. And I'm like, I will tell you, as a person who's a vegetarian for 10 years, how much work it was. It was so much work to make sure I was getting enough protein and make sure I was getting my nutrients right. And that is somebody who has a nutrition education. And I shudder for the people who are vegan and are like, protein just happens and like, I'll be fine. And like animals live on plants, and like this kind of mindset that I'm like, no, like it's actually not that easy. It's animal protein makes it really easy to like get a lot of these nutrients. And so, not saying you can't do it. I'm just saying that you got to commit to it. And also, I want you, people are always like citing like famous vegans and vegan athletes. And I'm like, yeah. Look at their lifestyle. Is your lifestyle like theirs? Or is your lifestyle conducive to you committing hours every day to like meal planning and making sure that you're getting everything? So again, I'm not saying it can't be done, but I am saying that your diet shouldn't be another source of tremendous stress in your life. And especially when you're trying to adhere to being perfect, which is the other piece of this, in that we want to avoid more than 25 grams of added sugar in our diet. This is great for everyone, but especially as we get into perimenopause. If you want to fast track your way to belly fat, especially as your estrogen drops, consume more than 25 grams of added sugar and don't get 25 grams of fiber every day. This is what the research tells us. And if you're like, how do I do this diet stuff in perimenopause? drbrighten.com/plan. I put together a perimenopause weight loss guide, and it's called a weight loss guide because that's what everybody wants, but it's actually focused on anti-inflammatory meal plan, anti-inflammatory recipes, making sure you're working on your stress, your sleep, and then it goes through like what an ideal kind of training program would look like for the average woman. And spoilers, it's going to be a lot of strength training because you need that so bad in perimenopause. So, okay, so we covered like what the plate should look like, and we covered the, avoiding the 25 grams of sugar. That's what I was going to say. Not about perfection. I very much tell people all the time, you want to read your labels. You may think you're doing really good with yogurt. Yogurt is the most nefarious, I feel like, in this conversation, because it's like 20 grams of protein and then like 20 grams of sugar. You don't want to waste your sugar on yogurt. It's not that good. Waste it on a cookie, invest it in the piece of cake. And so it's not about being perfect, but it's about structuring your life in a way that you're loading up on the nutrients, you're supporting your gut health, you're supporting your hormones, but you're also having pleasure. I've lived in France, in Paris a few times, and it's the biggest thing I took away from being amongst that culture is that pleasure is absolutely a necessary part of living. Okay, we can't We can't just be so adhered to a diet that we're not actually living. We need to have pleasure. It's a necessary part of the human experience. Even the World Health Organization is like, pleasure is really, really important. This is why the whole sex conversation was really, really important. And then I will also say the other piece is that I come from a big Mexican family, and sharing food in a community is more important than eating the perfect food while you're with that community. And so I want people to understand that the majority of time we're going to eat in this like really nutrient dense diet, but we are also going to do what humans do and seek pleasure and enjoy pleasure and seek community and enjoy community. And I think the worst thing that I look back at, like one family reunion I went to, and as a vegetarian, which is really funny in a Mexican family, because they were like, oh, you're vegetarian, so you want this pork. I'm like, no, I don't eat pork. Oh, then you eat the chicken, right? No, I don't eat the chicken. And I look back at that and I'm just like, man, like I was stressing myself out by adhering to this vegetarian diet. And like some of my relatives, because as Latinas, we love with food. Like that's like, I love you if I cook for you and I prepare food for you. If I am like, yeah, I don't really want to share a meal with you, I probably don't like you. I just told on myself. And so I look back at that and I'm just like, man, like that was like, there's something in my 20-something-year-old self. I'm like, honestly, like the diet wasn't as important as spending time with your family and your community. And I think sometimes we lose sight of that as we're trying to obtain these perfections in health, and understanding that, God, perfection is a fast track to elevated cortisol, to diminished progesterone, to poor sleep, to like, the metabolic outcomes we don't want to see.
Oh, I love that. It's so great. And I mean, community is a huge piece of just your mental health and who you are as a human being. But you did mention strength training, and
Yeah.
that is what I do. So
I
they hear
know.
it from me. They hear it from me all the time. Let's hear it from Dr. Jolene Brighten. Why do women need to strength train?
Oh my gosh. So when I was studying for my master's in nutrition, it was in sarcopenic obesity. This is where the cognitive dissonance got real as being a vegetarian and understanding the impact of branched chain amino acids, leucine, isoleucine, and valine in terms of preventing sarcopenic obesity, which is honestly, I don't know. To me, it's like scarier than osteoporosis, because it's what is going to lead to osteoporosis. And why is osteoporosis scary? Because if you're in your 20s, you might be like, why is that scary? Because if you break a hip, like you more than half chance you're going to die in the first year following that hip injury. So we don't want that. Okay. So with that, okay, wait, what's sarcopenic obesity? I like to explain the round M&M guy with the skinny little arms and the fat little body. That's sarcopenic obesity. You lose your muscle on the extremities and you pack fat in around your organs. That fat is metabolically active in all of the worst ways. We're talking insulin resistance, we're talking inflammation, we're talking increased cardiovascular disease, stroke. Like, we hate this fat, okay? And people will call this belly fat, and then they're like, oh, you're not being body positive. Oh, hell no. Love yourself where you are right now, because honestly, it's one of the best ways you can drop inflammation, is saying really nice things to yourself and being like, I love myself where I'm at, and I'm going to be the best version of myself. Watch me get it. Okay. So absolutely, we can be positive about where we're at, but also recognize that if your waist is expanding, then your organs are in danger. Okay. So we want to prevent that the best way. There's nutrition. Yes. If you don't eat enough protein, forget it. You're not going to build any muscle. Like, forget it. It's not even going to happen. But in eating enough protein, you also have to stimulate the muscles. And so we have to be strength training. And if you're listening to this right now and you're like, okay, well, I'm not doing much of anything. Like, I've been a runner, right? I'm a marathon runner, or maybe I just sit on the couch. That's okay. Like, we all start somewhere. You got to start with body strength training. And this is something I get so freaking mad about on the internet, is when people are like, oh yeah, you're lifting your little 5-pound weights. Oh, like you're going to like just do Pilates. Oh my God, do Pilates, because most people are not engaging their core right. And then they're ending up with back injuries or urinary incontinence. Like, you need the Pilates. It's part of like, I'm actually post-excision surgery. I just spent 3 months rehabbing my pelvic floor and working on just activating my transverse abdominis. Seriously, like some of the hardest work. effort.
So hard.
And
Yeah.
now I just got into where I can do Pilates once a week with my physical therapist. And then I'm also doing it at home. And I found like, it was just last week that I was like, okay, I'm going to do my Pilates session and then I'm going to strength train. And I couldn't strength train because then my core couldn't keep up. I was like, no, I'm going to have to just do body weight exercises because I don't want to get hurt. So I want to give you permission to start with your body weight because getting hurt means not training. And that's the worst thing that we can do. And so you can start right now today, body strength training. Like you can go on YouTube is like so amazing now. I'm like, oh my God, there's like a plethora out there of really great trainers. And so you can start there. And then I would say if you want to go into the next level of lifting weights, if it's within your budget, working with a personal trainer. Because if you're new to this, having someone put their hands on you, excuse me. So having someone put their hands on you and correct your body and correct your posture. It is always form first, movement second, because especially if you are in perimenopause or menopause, you are more prone to injury. You are more prone to injury because of the way that your hormones are changing. When estrogen starts to decline, inflammation goes up in the joints and the flexibility of the joints can be hindered. So we got to be strength training. When's the best time to start? Absolutely right now. Right now, you're never too late to do it. Like literally you will go on like TikTok or something and look for these older ladies who like start in their 70s. And I'm still like, this flies in the face of a lot of research that says like you can't have gains like once you get to a certain age, and yet they do it. And I'm like, women are amazing. Like, I'm sure they're on some HRT and they like, that's like helping some of these women, but like, yes, like believe me, when my time comes, I'm signed up for that 100%. So when it comes to strength training, if you're not hitting at least 2 days, you're not really going to see the benefits of it. And you may need to start at just 2 days. But the reality is, especially as we get older, it's going to look more like 3 to 4 days of strength training. And well, people will say like, well, you should have just a day of mobility. I think you should work on mobility every single day as well. Because like I said, the ligaments are changing, the flexibility of your tendons is changing. And, I think sometimes, so I used to be a group fitness instructor. And people always ditched the cool down. They always ran out. And I would tell them, I'm like, don't ditch the cool down because eventually I'm not going to see you for 6 weeks because you're going to be hurt. And it always went that way. And I'm like, why? And here I was in my 20s and these people were like in their 40s and 50s. And I was just like, why do I have to tell you this? And you have to learn the hard way. Like instead, why don't you just listen and not learn the hard way? And I think it's like, one, people were just trying to fit in the workout while they could, right? And they're probably like really busy. But I also think that there's just this idea that flexibility is not as important as like lifting the weights or doing the cardio as hard as you can. And we really need to be doing the cardio aspect, which might look like, doing high intensity interval training. I actually just like to, my favorite way to integrate cardio is like doing a set and then doing like jumping jacks or high knees or doing things. So I'm like, okay, I'm getting my heart rate up and then I'm going into another set. And I like to alternate in that way because I just find cardio to be the most boring thing in the world. I have ADHD and I swear in my 20s, I had to become a spin instructor in order to actually do cardio. And I had to teach something called body combat to actually, and that one I will do more because it's so much change and so much happening in your brain, but like, it's just so boring to do cardio for me. And so so if you're that person, I want to give you permission to say, yeah, it's freaking boring. And you got to find a way that it works for you. And then the other thing I would say is you also have to get movement throughout your day. It's not enough once you get in your 40s to just do one exercise, right? And like you can strength train in 20 minutes and definitely have results from that. So that's the other piece I want to say is it doesn't always have to be an hour of your time. You can isolate a muscle group and really focus there, but you also have to be moving throughout your day. So I'm someone that has a treadmill desk. And again, because it's so boring for me unless I'm like, I walk to the grocery like all the time because I'm like, if I'm walking somewhere with a purpose, I will like get get my heart rate up and like, yeah, I've got a mission. Like, and then I carry all the groceries home and I'm like, basically doing farmer carries like on the way home with groceries. But I also have a treadmill that I got under my desk, and they're actually really cheap these days on Amazon. So getting a treadmill, maybe where you watch TV. So you're watching TV and you're walking on a treadmill. I do it at my desk as I'm like writing my book or editing articles and things like that. I'm just at my desk, just walking, trying to increase my pace, watching like, I have a wearables. They're so great for feedback and keeping you on track. But making sure that you have ways to get movement throughout the day. My Apple Watch is kind of annoying sometimes because like I'll literally get in bed for going to sleep and it's like, it's time to stand. And I'm like, I was brushing my teeth and doing all this stuff in the bathroom and now I'm in bed. You say it's time to stand. But I do appreciate the reminder because when you have something, you don't have to have a fancy Apple Watch. You can set alarms on your phone that every hour you're getting up and moving your body, you're stretching, maybe you're doing chair yoga, but you have to be getting movement throughout your day. And why I say this in your 40s is again, because as your estrogen's declining, you're going to have that inflammation. You're going to have the joint changes that are happening. So we talked about testosterone. We know that's important for muscle. Estrogen's also important for muscle. And so we want to keep stimulating. We want to keep circulation flowing. We want to make sure that we are moving freely in our body often.
Well, I love it. I'm going to throw in a shameless plug because my program Broads, which I'd love to have you part of, is strength and
Yeah.
mobility training. It's all geared for women 30 plus, and it's all about starting you where you're at. We have home and gym exercises and workouts available. But yeah, I love the way you said it. It's you want to move throughout the day, you want to get in your step count. There's all these things, but if you can just start with 5 minutes or 10 minutes after this podcast, doing 10 body weight squats and a couple push-ups on an incline, that is still strength training. And you can start from wherever and you can just always build on that. So I love what you said.
I love that you say the 5 to 10 minutes. It's so important. Like that is something that I remember, when I was being a group fitness instructor, that's how I worked my way through college. And, it'd say something like, we're going to do push-ups. Like you can do anything for a minute, like 1 minute. That's all we're going to do. We can do anything for a minute. Then coming to understand, like having ADHD, I work with so many neurodivergent women, so ADHD, autistic women going through menopause. And when you are going through perimenopause, menopause, as your estrogen declines, so does your dopamine. Dopamine's all about like, let's get it because we like the reward. Like, let's do the things that are going to give us the reward, but you feel less of a reward. You feel you're not motivated to work out. You're less rewarded when you work out because of these hormonal changes that are happening. And it is something that I have found is so powerful to say, like, can you just do 5 minutes? As I was saying with my endometriosis, I know 15 minutes is the sweet spot where my endorphins will kick in and I will be out of pain. I shared this on my Instagram, being pregnant, the nausea. It's very interesting because I was so nauseous before this started. If I engage my brain and I get going, the nausea goes away. I was telling you, like, I think we've been telling women wrong to tell them to eat carbs and just like eat a little bit of crackers. Cause I did that in 2 pregnancies and I still was so nauseous. And this time, because I told you I'm 44, I don't want to lose muscle, but also my risk of preeclampsia, so having dangerous hypertension, is really high at this age. I'm like, one of the best ways to combat that is get my protein up. So I'm like 110 grams has to be every single day. I have found that like the minute I wake up, I shove 20 grams of yogurt protein in my mouth and I will not be as nauseous. Before we started this, I got really nauseous because I had told you, like, usually I'm doing that at 6 a.m. I slept until 8 because my toddler was like up all night. But the other thing too is like yesterday I was like, man, I'm starting to feel nauseous. I ate 4 hard-boiled eggs. I was like, I'm not as nauseous. Like, this is amazing. The other thing about like working out is I'm like, oh God, like I don't feel good, right? I'm tired, all this stuff. And I tell myself like, can you just do 10 minutes? Can you just do 10 minutes? And 30 minutes later, I'm like, I feel amazing. Like, this is so great. The getting started part is the absolute hardest part for everyone. So if you just tell yourself, all you have to do is 5 minutes, you're very well going to find you go past 5 minutes. But if at 5 minutes, you're like, I feel like absolute garbage, Listen to that because you might be getting sick. You might have something else going on. And sometimes I think the worst thing we do is push through when we're feeling awful because we think like, no, I just need to suck it up. I need to do it anyways. When maybe your body is telling you like, no, there's actually a problem here. You're going to do better to rest today. Like maybe you had absolute horrible sleep. If you have absolute horrible sleep, very hard to work out. Also very hard to recover from the workout.
And I think this is a great point to say, like, even if you have a scheduled strength training or a scheduled workout for the day, it can change. Goes back to what we've been talking about with just like being aware of your body and your intuition and like what your body needs. But if you can start with 5 minutes, starting a timer, or start with the warm up, that typically gets you to keep going and get you excited.
Totally.
Yeah. This was a wealth of knowledge. I feel like we could talk about this all day, but I respect your time. What is one thing we can leave with the audience that is a non-negotiable habit? Let's say specifically women going through perimenopause and menopause, that will get them through a lot of this stage of life.
Aiming to get the best sleep possible. And it is the least sexy recommendation. But if you want to have worse hot flashes, worse brain fog, worse energy, you want to have a worse time, skimp on your sleep. So, sorry. So, when we are in perimenopause, it can be harder to get sleep. That is because progesterone is declining. If you're not a candidate for progesterone or you haven't found a doctor who's willing to give you progesterone yet, using things like phosphatidylserine, which is an amino acid that can drop your cortisol levels, passion flower, which will interact with the GABA system in your brain, which is what progesterone would be doing, L-theanine. This is really great if you're someone who has anxiety. It comes from green tea, but it's green tea has a lot of benefits. Getting enough green tea in to hit the L-theanine levels of like 200 milligrams, that's going to probably give you anxiety from the caffeine. So we usually take that as a supplement, but that can also help with GABA. It can help you get better sleep at night. And then you have to, and I give you those because those are things outside of melatonin. Melatonin will help you fall asleep, but it won't help you stay asleep. Now, you've got to, so I just want to give you this because you might already be like, I am doing the bedtime routine. And then so I want to just give you that right away. But you do have to do the bedtime routine. You do have to treat yourself like a toddler. Okay. You have to nurture yourself. So we're talking lights out and room completely dark and make it cool. Like 65 degrees Fahrenheit is going to be ideal for most people. When your body temperature goes down, or excuse me, when the room temperature goes down, your body temperature is going to come up. It's going to help you get into deep restorative sleep. And we want to make sure the room's completely dark. Leading up to bed, do things that relax you, not watching like White Lotus, right? Everybody just watched that season finale or like really stimulating things before bed, not getting on social media. Honestly, lock your phone away if you can, because right now the news is like a complete, devastating cycle over and over meant to amp you up. Like, don't let the news ruin your hormones for their ad dollars, right? Because that's what they're doing. They're ruining your hormones, they're disrupting your dopamine, and they're doing it so that their ad spenders spend more with them. Don't let that happen. Don't fall victim to that. So we want to have that bedtime routine. We want to be in that completely dark room. If you are someone who wakes up, so blood sugar dysregulation is really common at this stage of life, you need to check your macros during the day, your protein, your fat, your fibers, all happening. However, before bed, you might be someone who does well with having something like, I like to do in Beyond the Pill, I have this upgraded golden milk that I love, and it's golden milk, and I put like a little bit of butter in it. I put a little bit of, not a little bit, I usually put 2 scoops of collagen in it. It's like 20 grams of protein, a little bit of honey in there, and if you don't want to use butter, you can use something like cream. It's just to have a little fat around, and drinking that before bed can help you stay asleep through the night. So if you wake up and you're like, I'm anxious, panicked, and hungry, yeah, you need some blood sugar support. And then when you wake up in the morning, hit that sunlight first thing in the morning. That helps degrade your melatonin, which is what we need, and spike your cortisol, which is exactly what should happen physiologically. And when you do that in the morning and you get up and you get active, you are actually going to set the stage for better sleep at night. And if none of this is working, then I want to ask, how hard are you working out in the day? Because anybody who's ever had a toddler knows if you don't run their energy out, bedtime is so much harder. You're no different. Just because you've got 40-something years on a toddler, you're still operating the same system.
Oh, I love that. And she gave us so many tips, you guys. So you don't have to try all of them, but try a few. Trial and error is so much of what we talk about just on this podcast and what you have put out in all of your books. I still have, is it normal? It's just sitting right over there. I always send all of my clients to it. You give such incredible information. Thank you. Thank you so much for being on here today. Where can people find you? You've gave a lot of resources. We'll definitely link them in the show notes, but where are you mostly? Because I've been seeing you a lot on Threads.
I know. So,
I
well,
love
I
it.
am, so drbrighten.com, DRBRIGHTEN.com is my main hub. And I put out, it's so funny because people have been saying to me, I mean, I have like 15 years of content up there, and people are like, you should really put that behind a paywall in Substack. You could make so much money. And I'm like, I do what I do. Like, this is more of like a passion of like, I want to put this information out there for women and stop gatekeeping. And I'm like, I really love getting the stories where people are like, I read this one article of yours and I did this stuff and things got better. And I'm like, hell yeah. Like, that's so awesome. So I am on Threads a lot. I love Threads because I can just like say 20 different things in a day and it doesn't matter. And it's, I'm also on Instagram, but I say I'm harder to find these days on Instagram because I realized that I'm not inflammatory or doing shock value or shaming people. I'm too
Yeah.
nuanced for the algorithm. I was making a joke about how easy it was when I just talked about this stuff and I was growing on Instagram and everything was fine. And then the algorithm changed and it's like, yeah, you've got to be like pissing people off. And I'm like, ah, I don't really want to do that. Like, and
Yeah.
so I'm still there putting out content, but they're like, yeah, you're not making people mad enough. And I'm like, so if you want a regulated nervous system, hang out with me there
Yeah.
because I'm not there, but I do get pissed. And I will rant about things, which I think, pisses off doctors who want to keep doing their job mediocre for women, and don't want to step up, but not usually pissing off patients. And then, yeah, I'm also on YouTube. I have the Dr. Brighten Show, which is my podcast, which we're going to have you on for sure and talk all about strength training because that's your wheelhouse of expertise. But yeah, I'm pretty much everywhere on social media, but you can just find me at Dr. Jolene Brighten.
And I will tell you, one of my past contractors actually reached out to me and they were like, I can't believe you're interviewing her. She helped regulate my period. Like everything that you put out there, like helped her so much. So you are helping so many women. And again, we thank you so much for your time and all of your knowledge and wish you all the best.
Oh, thank you so much.